You may hear the term bipolar used to describe someone who is moody. Bipolar disorder is a little more serious than that. Most people assume that people diagnosed with this disorder bounce back from one extreme to the other, meaning that they bounce back from depression to mania. But in reality, this isn't the case. There are two types of bipolar disorder, bipolar 1 and bipolar 2, and they vary. We will take a look at both of these cases and distinguish between the two while talking about causes and treatments. We will first look at bipolar 1 disorder. Bipolar 1 disorder is characterized by having manic states. Before going any further, a manic episode is one in which a person has an extremely elevated mood. We will look at the symptoms in just a second. These people can also suffer from depression episodes, but that is not always the case. We will now begin talking about the symptoms associated with bipolar 1 disorder. These symptoms can include pressured speech, increased energy, decreased need for sleep, inflated self-image, hypersexuality, and substance abuse. You can see that all of these symptoms relate to a manic episode because it is actually required to be diagnosed with bipolar 1 disorder. These patients can also suffer from mixed episodes where depressive and manic symptoms occur simultaneously. These episodes can last for a few days to several months. We will now take a look at bipolar 2 disorder. Bipolar 2 disorder differs from bipolar 1 disorder in that an individual must have a depressive episode. These individuals also never reach a full manic episode. Instead, they only reach a hypomania episode, which is not as serious. Associated with bipolar 2 disorder is a depressive episode. This must include a depressed mood lasting at least 2 weeks. They must also have 4 other depressive symptoms that also last 2 weeks. This can include sleeping disturbance, psychomotor agitation or psychomotor retardation, appetite disturbance, weight change, loss of energy, feeling of worthlessness or guilt, difficulty concentrating, or recurrent thoughts of death and suicide. These individuals can also have a hypomanic episode. This is a distinct period of time in which the predominant mood is elevated or expansive for at least 4 days, and there are some mild symptoms of manic episode. Some people might not consider a hypomanic state a disorder. These people may seem like the life of the party, but it is important to remember that these individuals can have impulsive behavior and can make rapid and bad decisions. The depressive episodes may directly follow a hypomanic episode, or they may occur later. Some may alternate back and forth. The key point about bipolar 2 disorder is that these individuals are depressed, whereas bipolar 1 individuals may not have depressive episodes. The individuals diagnosed with bipolar 2 disorder are more likely to commit suicide than bipolar 1 individuals because they have the depressive states. For example, my dad has been diagnosed with bipolar 2 disorder. If you saw him out on the street, you would probably never guess, but he suffers mainly from depressive episodes. However, I know firsthand how dangerous hypomanic states can be, and much of my childhood was spent alternating between his depressive states and his hypomanic states. He can be very impulsive and make decisions that are dangerous not only to his life but to others around him. He also suffers from suicidal thoughts. Even though his disorder is very hindering, he refuses to take medication for it. Instead, he chooses to live his life battling between the ups and downs, and he really brings everyone down with him. Instead of taking medication, my dad abuses alcohol quite frequently, and this only makes his bipolar disorder much worse. Around 1% of people are diagnosed with bipolar disorder. It also seems to affect men and women equally. The age of onset is close when you compare bipolar 1 with bipolar 2. It is typically between ages 15 to 18 that people are diagnosed with bipolar 1 disorder, whereas bipolar 2 disorder occurs between the ages of 19 to 22. The course is chronic and the disorder has an acute onset. The cause for bipolar disorder seems to fall like all other disorders. It seems to be a mixture of biological, psychological, and social factors. There seems to be a dysfunction of certain neurotransmitters in the brain. These can include norepinephrine and serotonin. This disorder could be activated on its own or be triggered by certain circumstances like psychological stress or social situations. People without a genetic predisposition can develop bipolar disorder. Health habits like alcohol and drug abuse can trigger an episode. Treatment can include mood stabilizers, atypical antipsychotics, psychotherapy, and antidepressants. One type of antidepressant that really seems to help bipolar patients is lithium carbonate. The dosages must be regulated in order to prevent poisoning, though. It is often effective in preventing and treating manic episodes. Other antidepressants can actually lead to manic episodes without pre-existing bipolar disorders, so lithium is the golden choice. As for depression, tricyclic antidepressants are used as well as SSRIs, which help regulate the serotonin levels. As for psychological treatments, cognitive behavioral therapy can help correct depressive errors in thinking. By changing this, a therapist can actually bring a person out of depression. The therapist has to dig deep because sometimes the errors in thinking are automatic and beyond the client's awareness. By changing the errors in thinking, one's view of the world could change, and this can actually cure depression. Before ending the video, I think it's important to reconsider what bipolar 1 and bipolar 2 are. Bipolar 1 consists of a manic or mixed episode which must last 7 days. Bipolar 2 consists of a hypomania state which lasts 4 days with major depressive episodes which must last 2 weeks. Now that we have discussed what bipolar 1 and bipolar 2 are and the treatment options available, I hope that you can see that this disorder can be managed. There are numerous treatment options available for those diagnosed with bipolar disorder. It is important to receive the correct treatment in order to live a normal life.